Guasha, which is also called scraping, is a great technique to manage many different conditions, including musculoskeletal pain. In this video, we'll present Guasha and also show you how to conduct Guasha in the clinic. Guasha is a therapy in which a blunt instrument like this one is used to scrape soft tissues. In Mandarin, Guasha means literally scraping to produce some sand-like marks on the skin, because these techniques actually produces some red marks on the skin. In general, we use also oil to make sure we minimize damage to the skin when we are doing Guasha. The functions of Guasha are basically to move qi and blood and also to expel pathogens such as wind cold and also heat toxicity. It's also great to relax and also to adjust soft tissues. We can use Guasha for many types of conditions, including common colds, musculoskeletal conditions, chronic pain. We can also use it for skin condition and for neurological conditions. And we are now going to show you how to use the Guasha techniques. We are now going to do the Guasha technique on the upper back. So again, you need to wash your hands, make sure your patient is in a comfortable position and will be able to stay like this for a couple of minutes. And make sure also you uncover the area where you're going to do the Guasha. It's very important to have the hair away, and you can use a towel like this to make sure the hair won't be in the way. Now we need to have our equipment, which is our Guasha tool and then the oil. It's very important to have oil, otherwise this may be irritating for the skin. So we make sure we have enough oil in the area, so we can actually use our Guasha tool to spread out the oil around. And you can use a paper towel like this if you want to make sure the oil is not going to go on the bed. Alright, now when we're ready, we're going to do some strokes, some on the bladder channel. So it will be top-down movements, strokes, 20 to 40 strokes. Let's go. We have to keep enough pressure. It's generally not painful, so don't worry about it, and you need to have enough pressure. So Samantha, I'm going to start to do the scratching, so you'll feel some pressure. If it's uncomfortable, just let me know, but it shouldn't be painful. Let's go. So again, it's important to not have the hair on the way. So if you see the hair coming down, you just push them back with the towel. Here we are, and continue. Okay, so we have done the bladder channel. We're now going to go down on the gallbladder channel, which is about the trapezius area. This is generally a very tense area in the body. How is it going, Samantha? Is it painful? It's good? Alright. So it looks like it's going to be painful, but actually from the patient it's not very painful. So we always do the stroke in one direction. We don't go back and forth. So always here in top-down direction. So you can see here that the stagnation, there is obviously some stagnation over here, and we'll see the kind of marks are coming out. Alright, so this is normal, part of the Guasha technique. So after that I could jump to the other side and do the other side. Usually we do both sides when we're doing Guasha. Now there are a few precautions you need to be careful about. So one of the things is when we are around bony areas such as the spine, we have to use light methods, otherwise it might be painful. So I have to be gentle, otherwise if I go too strong, it might be painful. Then we have to be careful not doing guasha when there are skin ulcers, when there is edema, or when there is large blood vessels in the area. So you have to be careful. It's contraindicated in these situations. When you are doing guasha for pregnant women, avoid the lower back area and the lower abdomen. And also be careful with patients with a tendency of bleeding. You might take some extra care for this type of patients. I hope you enjoyed this video. My name is Yoann Birling, clinician, lecturer and researcher. This video was produced by Sydney Institute of Traditional Chinese Medicine. Please check our tutorials and more information on the school in the description below. You can join our community and also give this video a thumbs up if you liked it. Good practice and take care.